Good evening, friends. It is amazing to participate in this 800 meeting of IFPH Zoom meeting. I am overwhelmed with the spirit, enthusiasm, and dedications of the organizer who had been constantly working to maintain the regular webinar every day at 8 p.m. without any break. It only speaks of the genuine dedicated thoughts of IFPH. I had opportunity to participate on several occasions and I always remained ready to express my views, whatever I have in my mind, stock of mind. Today, the theme of this webinar is My Health, My Right. It's just a timely realization for protecting the right of healthcare, especially in our context, homeopathic practitioners. Friends, people around the world are faced to exercising their right to health. Realization about the right to health and what impact it has on people's life is not new. Entire civilization since the very beginning has been striving for having a healthy life. This has created a evolutionary history for the definition of the health. From beginning from the health of the physical body only, we extended to beyond the mind and now for the society. So health is not limited to the physical body, it has been extended to the entire civilizations. It also aims to increase the visibility around the need to achieve the full realizations of the right to health for everyone, everywhere. Friends, almost all the sustainable development programs are linked in some way to the health. So achieving the sustainable development goals, which includes every system of medicines being practiced around the globe, will depend heavily on ensuring the right to health. Being able to make our own decision about our health, body, and sexual life is a basic human right. Whoever we are, wherever we live, we have the right to make these choices without fear, violence, or discrimination. Yet, all over the world, people are bullied, discriminated against, and arrested for simply making choice about their body and their lives. A woman is refused contraception because she doesn't have her husband's permission. A teenager is denied a life-saving terminations because abortion is illegal in her country. A man is harassed by police because he is gay. Friends, the WHO Constitution 1946 envisaged the highest attainable standard of health as a fundamental right for every human being. Understanding health as a human right creates a legal obligation on the state to ensure access to timely, acceptable, and affordable health care of appropriate quality, as well as to providing for the underlying determinant health, such as safe and potable sanitation, potable water, sanitation, food, housing, health-related information, and education and gender equality. A state's obligation to support the right to health, including through the allocation of maximum available resources to progressively realize this goal, is reviewed through various international human rights mechanisms such as the Universal Periodic Review or the Committee on Economic, Social, and Cultural Rights in many cases. The right to health has been adopted into domestic law or constitutional law. A right-based approach to health requires that health policy and program must prioritize the need to those furthest behind first towards greater equality, a principle that has been echoed in the recent adopted 2030 Agenda for the Sustainable Development and Universal Health Coverage. The rights to health must be enjoyed without discriminations on the ground of race, age, ethnicity, or any other status. Non-discrimination and equality require states to take steps to redress any discriminatory law, practice, or policy. Another feature of right-based approach is meaningful participation. Participation means ensuring that national stakeholders, including non-state actors such as non-government organizations, are meaningfully, which also includes alternative system of medicines and homeopathy involved in all phases of programming, assessment, analysis, planning, implementation, monitoring, and evaluation. Violation or lack of attention to human rights can have serious health consequences. Overt or implicate discrimination in their delivery of health services, both within the health workforce and between the health workers and service users, act as a powerful barrier to the health services and contribute to poor quality care. Mental ill health often leads to a denial of dignity and autonomy, including forced treatment or institutionalization and disregard of individual legal capacity to make decisions. Paradoxically, mental health is still given inadequate attention in public health in spite of the high level of violence, poverty, and social exclusion that contribute to worse mental and physical health outcomes for people with mental health disorders. The human right-based approach to health provides a set of clear principles for setting and evaluating health policy and health service delivery, targeting discriminatory practice and unjust power relations that are at the heart of inequitable health outcomes. In pursuing a right-based approach, health policy, strategies, and programs should be designed explicitly to improve the enjoyment of all people to the right to health, with a focus on the furthest behind the first. The core principle and standard of a right-based approach includes first, the accountability. States and other duty bearers are answerable for the observance of human rights. However, there is also growing movement recognizing the importance of other non-state actors such as business and in the respect and protections of the human rights. Next point is equality and non-discrimination. The principle of non-discrimination seeks to guarantee that human rights are exercised without discriminations of any kind based on race, color, sex, language, religion, politics, or other opinion, national or social origin, property, birth, or other status such as disability, age, marital and family status, sexual orientation, and gender identity, and health status, places of the residence, economic and social situation. The principle of non-discrimination and equality requires WHO to address discrimination in guidance, policy, and practice, such as relating to the distribution and provision of resources and health services. Non-discrimination and equality are key measures required to address the social determinant affecting the enjoyment of the right to health. Functioning national health information system and availability of this aggregated data are essential to be able to identify the most vulnerable groups and diverse needs. Third important point is participation. Participation requires ensuring that all concerned stakeholders, including non-state actors, have ownership and control over development process in all phases of the programming cycle, assessment, analysis, planning, implementation, monitoring, and evaluation. And finally, the universal, indivisible, and interdependent. Human rights are universal and inalienable. They apply equally to all people everywhere, but without distinctions. Human rights standard to food, health, education to be free from torture, inhuman or disregarding treatment are also interrelated. The improvement of one right facility advancement of the other. Likewise, the deprivation of one right adversely affects the others. Friends, the core elements of the right to health includes progressive realizations using maximum available resources, no matter what level of resources they have at their disposal. Progressive realizations requires that government take immediate steps within their means towards the fulfillment of these rights, regardless of resources, capacity, uh, towards the fulfillment of capacity, the elimination of discrimination and improvement in the legal and judicial system must be acted upon with immediate effect. Second point is non-retrogrations. A state should not allow the existing protection of economical, social, and cultural rights to deteriorate unless they are a strong justification for retrogressive measure. For example, introducing school fees in secondary education, which had been formerly been free of charges, would constitute to deliberate retrogressive measure. To justify it, a state should have to demonstrate that it adopted the measure only after carefully considering all the options, assessing the impact and fully using its maximum available resources. Violation of human rights is not only contribute to an exaggerated poor health, but for many, including people with a disability, indigenous populations, women living with HIV, sex workers, people who use drugs, transgender and intersex people, the healthcare setting presents a risk of heightened exposure to human rights abuse, including coercive or forced treatment and procedure. Friends, moral principles and ethics are essential and indispensable from the medical practice. The father of medicine, Hippocrates, introduced the corpus Hippocratic in the last decade of the 5th century. Physicians have been starting their career by swearing the solemn oath called Hippocratic Oath from the corpus Hippocratic called as Hawk's Oath for ages. Ethics is a moral and social principle that applies values that binds the society by uniform opinion or consideration and enable the society to decide what is right and what is wrong. It is the science of moral concerning the principle of human duty in society. Medical science is also not far away from this moral or social value. The mutual trust and relationship between the doctor and patient is an important factor in respect of the right, consent, and confidentiality of the patient. The moral values and the right-wrong judgment are ever-changing according to the need of the society and medical practice. Good ethics of past times may not be considered the same today. Friends, homeopathic practitioners also follow the ethics in general like allopathic physicians. The declaration of oath that the homeopathic physicians swear at the time of registration is an added responsibility that is supreme. The Hahnemannian oath guides homeopathic practitioners to take inspiration from Master Hahnemann's teaching and obtain the strength to believe in homeopathy. Ethical practice in homeopathy is determined by keeping in view of the highest and only mission for the homeopathic physician as mentioned in the first ephraim of organ medicine, that is to restore the sick to health. Friends, homeopathy has become an integral part of the complementary and alternating medicines and in many part of the Southeast Asia. Homeopathy had gained popularity among the wider population apart from the other traditional system of medicine around the globe. In our country, homeopathy has acquired a very parallel status along with the other system of medicines under the Ayush system of the medicine. Homeopathy is a system of medicines based on the idea of let life be cured by life, that is the similia similibus curantia. Based on 7 fundamental principles, the individualizations and preparation of medicines make it different from other system of the medicine, system of the treatment. Homeopathic medicines are prepared from trace of animal, plant, minerals and other natural substances by potentizations to raise their dynamic power. Further, to mention the status of homeopathy in the world is evident from WHO report, which reveals that homeopathy is one of the most common form of traditional and complementary medicines used by the member states of the WHO. In India, the practice of homeopathy is mainly governed by Concerned State Act along with the Homeopathic Central Council Act 1973, Homeopathic Practitioners Professional Conduct Equity and Code of Ethics Regulations 1982, Drug and Cosmetics Act 1942 and Rules 1945 and Clinical Establishment Registration and Regulation Act 2010, and recently it is the education system is under the control of National Homeopathic Commission. The physician is expected to serve humanity with all modesty and careful attend to the sick. The responsibility of the physician is extended toward the entire society. We have to emphasize on the objective and right of homeopathic practitioners who are part of the regulations needs a publicly explained. If we break the silence, then government will have to step up and start protecting people's right and to make decision about their bodies and their lives, and also will protect our homeopathy. Until then, we will expose states that violate these rights, and we will demand changes, because our entire organs, including sexual and reproductive rights, are human rights. They all belong to us. Friends, it is the right moment and right time that the choice of the health is a very individual matter, as well as the responsibility of the physicians and the states and entire machinery system of the government and all the stakeholders. So we are very much delighted today to present this, be the part of this webinar, and I am thankful to the organizer for inviting me to present my views on this topic. And with these words, I inaugurate this session, and I feel that we will have a very nice deliberations in the coming futures. So thank you very much.